If this panel's responsibility was to frame the need for surgical participation internationally, I think we've already done very well. With the three speakers that have talked, it's been easy to understand that surgical presence in the international setting cannot be ignored. And so my talk was going to talk a little bit about some of the things that we've done to try and do that, to try and provide some kind of capacity building. And I think I'll pass that and just make a few comments. One of the comments is last fall at the meeting of the CUGH. The CUGH is the Collaborative Universities for Global Health program that started about 3 or 4 years ago. It's a group of university people that are involved in global health. They had, I think it was their third annual meeting in Montreal this last fall. It was very impressive that there was a transition taking place in global health among the leaders in global health that led away from public health a little bit and infectious diseases and more to some of the other great needs that are present in the international setting. And surgery was one of those. And you can see a little bit about why that happens. If you look at some of the progress that has been made, there has been progress in public health programs. There are more people in the world now with safe water and sanitation. Is the problem completed? No. There's still a huge need, but we're making progress. The same is true with infectious diseases. I'm an infectious disease doctor. I love infectious diseases. But if you look at what has happened mortality-wise in the world, we have gone from approximately 1/2 of all deaths from infectious disease down to 1 in 5. We've taken a lot of the low-hanging fruit that is easy to make a difference in infectious disease, and now it's costing us more and more to make the progress that we have made so far with infectious disease. As we reach those kind of areas of progress, it's evident that there are a huge number of other areas that are also of great need. And so the two main new topics in this conference were a change to looking at chronic diseases. So you look at diabetes and hypertension and obesity. These are important problems now that also demand our attention with regards to the international setting. And then surgery. And surgery cannot be ignored. If you look at the interest at this conference and the interest that you have here is a great manifestation of the need for surgical interventions to be more available to the international community. So if you look at that, is this interest because the need hasn't always been there? No, the need for surgery has always been there. I think now that there are more people like you involved. There's more recognition that this is a serious area where we need to begin interventions. Now, it's not uncommon for medical students to come and ask me what they can do global health-wise. A number of them come and say, I am really interested in global health, but I want to be a thoracic surgeon. How am I going to be a thoracic surgeon and do global health? That's an easy question, obviously, to you. You find the area where that's developing and you participate. And one of the greatest opportunities internationally is to find the right place to start. And if you find a place where they are just starting a thoracic surgery program or a urology program, and they now have a champion of their own in their community, and we can help with that, that's probably the greatest benefit we can give as far as our time and our effort. If you look at some of the things that have just been talked about, it would be impossible to do all of the cleft palate surgery in India or the Philippines by a group of physicians from the U.S. dropping in now and then and doing that surgery. And as you listen to that talk, you realize that there's been a transition. So when I was in medical school, a lot of what we did was we went to places, we provided care. Now look at the emphasis. Look at the emphasis on training people to go in those settings to continue their activity when we're long gone. What a chance that is. What a great opportunity that we have to find areas where we have counterparts that are beginning their program, and we provide support and help and interest to accelerate that effort. I think it's been impressive. So I've been impressed internal medicine-wise with how our things have changed, but your areas have changed too. You look at what Catherine DeVries has done with urology. You look at what Ray Price is doing with teaching general surgery. You look at what we're doing, what's being done in ENT. Those opportunities that we have to contribute to the educational process are the things that will provide the best benefit of where we can contribute. Now, my talk today was just a little bit about that. When we looked at trying to find what we can do as a University of Utah to make a greatest effect on our efforts, we recognized, as you do, that educational exchange is the least expensive and the most productive of a program that could be developed. And that's essentially what our program is. And that can happen at all levels. Obviously, our students participate that, and our residents and our faculty. But the more advanced we are in our program, in our training, the more we have to contribute. So I think things are changing. I'm impressed that they're changing not only on the global health conferences that I attend, but also the increased interest and the increased activity of surgeons to become involved in this type of activity. And I think I'll stop there rather than present anything else.
Good.